Joining me today is Dr. Phillip Polakoff MD. He is the founder and CEO of a nonprofit, A Healthier We. And we're going to be talking about threats to democracy are bad for your health. The National Guard has been deployed to Los Angeles because Americans have exercised their right to protest. An unelected billionaire recently slashed the budgets of critical government institutions. And the Supreme Court has ruled that President Trump enjoys absolute immunity from prosecution for official acts he took while in office. The U.S. is facing unprecedented threats to its democracy. We've heard about the dangers of this from political scientists, historians, activists, and others. What we may not realize is these threats are also endanger our health. An eminent physician, Phillip Polakoff MD, says it's time to make this connection. Ultimately, the health of a population is a reflection of the health of its democracy. One cannot thrive with the other. Dr. Polakoff's previous positions have included being shortlisted for U.S. Surgeon General, Senior Managing Director of publicly traded consulting firms, advisor to numerous payers, providers, investors, employers, labor organizations, and public entities. Welcome to the show, Dr. Polakoff. Phil. You said I can call you Phil.
That's correct. And thank you, Kathryn, for having me on your show.
Okay, I think maybe it's just or I think many people don't realize or generally do not realize or make the connection between a political system and public health. So let's start with that.
Well, it goes back historically. If you think in the medical world, you had the Hippocratic Oath, that's you do nothing to harm another individual. You then move up to the Declaration of Independence, and one of the lines, all men are created equal to, with certain unalienable rights, that among these are life, liberty, and the pursuit of happiness. I think health is there, included in that thought process. And then more recently, the World Health Organization, in their constitution in 1948, stated that health is a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. And just continuing on a little further, we had the Affordable Care Act that gave many, many people insurance that they hadn't had before. And now all of a sudden, we're going south. Fewer people are having access to health care, the quality is diminishing, and the cost is going up. So it's totally intertwined with the political process in this country of giving people a better chance for life, liberty, and the pursuit of happiness.
So these attacks on democracy that I mentioned in the beginning in the intro, and we could speak more specifically about those, are undermining, you say, the social well-being and destabilizing our overall health. Can we give like specifics? Let's take it step by step. What are the specifics? Yeah.
That's a very good question. The specifics are the anxiety, the sense of isolation. It's almost we have an epidemic of isolation now, are significant. 70% of this country, based on the American Psychological Association, says anxiety is the number one state of stress now. People are having a hard time coping on a personal basis and a community basis what their social justice is.
All right, so I'm going to stop you there. So we are lonely, we are anxious, and I guess we do know anxiety and stress is not good for our health, right? But why are we anxious and why are we lonely, and how is this being played out, I guess? Because our democracy is diminishing and we're getting into an oligarchy, or how does that work?
I think you're spot on. The issue is people really don't know what their sense of security is going forward. They feel that they're at risk for their health, their risk for their economics, their risk for their children, the risk of the vaccine programs being taken away, especially now. Look at the number of cases of measles this year. It's never been this high in 40 years, ever since we had the vaccine. So it's managed. Can they get to care? Can you get the right maternal and obstetric care? Are your children going to be prevented from having asthma? What about the contagious diseases from being exposed to people who don't have the proper care, who might have viral transmission or tuberculosis? So the list goes on, Kathryn, significantly of why people don't feel empowered to live a life the way they used to and feel that they can support their family dynamics in the way they used to. The children or those a little older are worried about the employment status, and now they have a great deal of psychological concerns that are manifesting themselves in a variety of ways. The amount of violence that's existing in our country. And let's not forget natural disasters. What happened in Texas recently, where over 135 lives were taken away and now 100 are still missing. Or the pandemic, which killed millions of people. And now there's a thing about do we have access to vaccines or not? So there's so many issues that are rising, but people don't know how to collectively discuss it and they don't know where the leadership is going forward.
Yeah, you talked about leadership. So the leadership, as I see it, or as you're describing it, creates this instability. And that instability leads to chaos, and that leads to anxiety, obviously, for all of us in all those areas that you just mentioned. So and I think immigration is also one of the things, and I think you've talked,
Absolutely.
yeah. People are terrified that they are going to be put in jail and they don't seek health care because they're afraid. And then these communicable diseases can proliferate. I mean, I guess it just goes on and on.
I think you're spot on. But the issue is, in time of crisis comes time of opportunity. And I do believe what you're doing is critically important, creating a voice, a conversation. And we're in the process of launching a national petition called Health is a Basic Human Right to get people more engaged in how they express themselves and to make sure that the leadership, the political leadership, the community leadership, both at the local, regional, state, and national, hear a message that resonates. It's not easy to have productive transformational change, either on an individual basis or a community basis. But the time doesn't need this, doesn't matter. We've had so many stories that impact us even worldwide, whether it's the Middle East story or the Russia-Ukrainian story. These constantly impact, or the educational problems, of the major universities now under challenge of their leadership. The other one that's a significant issue is government itself. The federal government used to generate reliable, transferable data from the CDC or from the National Institute of Health or from the Department of Education. They're all under challenge. They're losing key people. Granted, there are some issues that you have to respect the amount of fraud and abuse that has occurred in Medicare. That's been documented for multiple administrations over the last 40 years. So that does have to be addressed. That's not a DOGE issue. That's just the quality of government service. However, you can't take away the weather forecasting people. You can't take away the Social Security people that people rely on. And change, if it occurs too rapidly, people don't know how to process it. So I guess I would give you one line: think bold, start small, move forward with passion and purpose.
That's good advice. Now, but I do want to ask you this, when you're talking about public health, what is the end, or what is your opinion as to what the end game is for someone like Robert Kennedy Jr. to, well, let's talk just specifically in terms of vaccines, which affect us all.
Well, specifically for vaccine, I don't understand why it would do away with the vaccine commission or panel. Okay, these were august people with great reputations, and all of a sudden they're laid off. And then recently, as of last week, he did the same thing with the Preventive Health Commission, whatever it is. He declined the meeting for this month. So people are questioning. He's not wrong when it comes to dyes and are carcinogenic. He's not wrong with eating good food. However, when you talk about wearables or using technical devices to monitor your health status, what does that mean that if you don't have access to healthcare, if your wearables are giving you bad data? Is it bad data or is it real trusted bad data? You need to have advice and you need to communicate. Technology is a great wonder, but even with AI, which is the major issue of the day, there has to be a human voice heard as well as a technological support system. So public health right now is being pushed back. It's not front and center. And public health has had some issues with its relationship with clinical care. So the two professions have to talk more directly with one another, have a common agenda, and pushing everything to the state level without some standards and regulations is a real challenge because every state views these issues differently, and the quality of overall care to prevent pandemics or prevent natural disasters varies from state to state with leadership, whatever. So somehow there has to be some uniformity and consistency to make this a stronger nation.
How do we get that? As you're talking about, we have to be talking with one another, obviously, but that communication when we are so split or splintered, how does that happen?
Catherine, I can't give you enough
We
credit
want
for
you
your
to, yeah.
Without ever meeting you, I applaud you on your questions. The solutions are not as easy as problems. Okay, so everyone wants to talk to problem solutions. If you start small and build on them, and you have a sense of purpose, that if you can create more interconnectivity, interactive voice, and interdependency amongst different agencies and think, to the future, what would a more prosperous society? Because other things impact on health, not just sick care. Right now, whether you want to accept it or not, we're spending $4.7 trillion on sick care, estimated by the advisory council or advisory group to go to 8.3 by 2033. It's going to 20% of the gross domestic product cost of our society. So we really have to find ways to have a less fragmented, more efficient, and more effective health delivery system. I didn't say health care, I said health delivery system, where we include housing into the equation, where we include education and the environment, because they all impact on one's overall health. And exercise and nutrition is still a key part of that. So we do have to present this in a way that one and all Americans can hear it, and we try to bridge the divide that exists between the different camps at the moment.
So don't we have to, aren't we talking about prevention and instead of after the fact, $4 trillion, you're talking about healthcare, preventative medicine and not specifically meaning, yes, disease, but just preventing, well, for instance, climate change. And you mentioned Texas earlier, and I'm thinking about first you have to accept that there is climate change and then
Well,
do,
not to interrupt you, but I would actually change the word climate crisis. I think how you present words make a difference. And if you make climate crisis more personal, it's causing you to have enhanced asthma. Your high blood pressure is going off the wall. Most people need to hear what impacts them personally, not the global words, to have an impact for change. That's all I'm saying. I'm not challenging you. I'm just saying you have to communicate in ways that are trusted and simple. And also, let me give you a specific story. I was in Omaha last week, and there the fertilizers have created a heavy burden of nitrates in the soil. Nitrates cause a significant enhancement of childhood diseases as well as enhancing chronic diseases. When they did a survey of physicians, 676 physicians, it turns out that 80% knew nothing about nitrates in the soil, and most of them never communicated with their patients about potential hazards from having poor water quality. So it's ubiquitous. Now the point is, how do we move forward with spirit, hope, and energy, and start small to get certain things done? How do we make the messaging in the next political cycles one that resonates more? Most people are concerned about basic human issues, whether it's the cost of eggs, the cost of gas, whether we have inflation or not. So how do we make this so people think that some things are tangible and trusted, that positive change is occurring?
well, I think that's a great example because you're talking about not only is the general public, as I understand what you're saying, we're not well informed or we don't inform ourselves, we don't talk amongst ourselves, but you're saying the experts also, the people that we look towards, you're talking about, I guess specifically these physicians, have to be able to be well informed and then communicate with us. And
Well,
they're
it's
not.
more than
Yeah.
that. I think the white coat collar, whoever's wearing it doesn't only have to be a physician. It could be a nurse, it could be a social worker, it could be a psychologist or someone in behavioral health. They all have to get in the community and get involved, not just on a professional basis, but on a civic basis. I think we all have a responsibility to be engaged. I can't tell you how. Everyone can define their community or their subcommunity in different ways, but you have to play a role in your church, in your community, in your job. And as I like to put forth, the 5 Ps, you have to deal with your personal care, your public health, your population health, the place you live, work, and play, as well as your political will to get to be heard and engaged.
I think another thing, which I guess takes maybe even more time, people change or crises, as you mentioned, climate crises. You have to have maybe lived experiences. You realize that, we have. I'm getting back to the climate change, but hurricanes and tornadoes, and it's constant and it's ongoing and it doesn't stop. And the same with medicine. Risk in terms of healthcare once you've lived through it. I think there was an article, I'm sure you saw it in the New York Times, the physician, the chiropractor in Texas who had been, he didn't have his kids vaccinated. He was the doctor for the whole community and outlying communities, small communities. And then this horrific outbreak of measles and his kids almost died. His kids, his 4 kids or 5 kids. That's a real story.
Oh,
And that's,
I did read that
yeah.
story, but that story repeats itself. The pediatrician has the same issue. Also, some people have been had their license put on suspension. It happens in both ways. The individual has to deal with both self-care and we care. Uh, we have to do things in a holistic, innovative, entrepreneurial way. But each culture is different. So I've done a lot in rural America, and rural is a great general word, but rural in Mississippi is different than rural in Montana or rural in Maine and the oyster thing. So you have to understand the local culture, and then the Native Americans have to be um, engaged in the conversation. There's relationships you have to have trust. They have to have trust in you as an individual for you to be engaged in their world. So it does take time, but it takes individuals and multiple people to be involved in what you're talking about. Also, just for factual reasons, we spend 2 to 3% of our healthcare budget on health promotion and prevention. It's a very low priority. On the other hand, people are making an excessive amount of money on supplements. Whether they're necessary or not is open to question.
I want to get back to, you say the differences in, because that you're an expert in that, the differences in rural communities, because I think we tend to lump things together, the rural communities and the cities, and it's either or, but you're saying it's very different. They're very specific, different kinds of cultures. So give us some examples, like, all right, Maine versus Montana.
Well, let me take a place where I had specific relationships recently is in Appalachia. Okay.
Okay.
In Appalachia, whether you want to accept it or not, I met with the descendants of the Hatfields and the McCoys. There, they have culture that's stuck by a historical point of view in the past. Change comes very hard to them. They don't really promote entrepreneurship or the like. They have a cold mentality where they had problems with pneumoconiosis, which is seemingly coming back to a certain case. They have a high rate of fentanyl, and fentanyl is part of the opioid addiction. And there, some individual professional gave me a line. Incomes are prioritized over outcomes. So people think that they should be entitled to the fentanyl. The doctors prescribe it and make some money. I'm not saying everyone, but a good number. The rehabilitations are ineffective and not very productive in creating remissions. So there you have a change, and it's beautiful. Appalachia, if you drive through it, is absolutely beautiful country, beautiful hollows, and whatever. But to have the change in leadership and the change of actual statistics hasn't come about very readily. So they're going to have to take on the issue themselves and bring in some outside help if they can get it, and get some outside funding to help them because their economic status is not great enough to have meaningful change.
Well, do you think that, uh, as I'm listening to you, I'm thinking there's a lack of leadership on local levels. We look to the president, we look to the Congress, and that gets the big splash. But really, local leadership is critical, and the trust, as you're saying, and the local communities have to trust in the leadership that they are doing the right thing, that they are concerned.
You're absolutely right, but there's another issue. It's called top to bottom or bottom to top. Are we going upstream or are we going downstream? So we have to try to get upstream. So in small communities, to get grants from the federal government, at least under previous administration, was near impossible. You didn't have the talent or the data to fill out the obligations that the federal government wanted to give you money. Then they created programs called the Rural Partners Network. They were in 10 states. I never saw, and I was on White House calls religiously, that I never saw the data of success stories. So you go from one administration to the next. I can tell you the previous Trump administration had someone in the Department of Agriculture who was very innovative and very talented. I don't hear it in a bipartisan way, clear messaging. I hear global messaging to attract support. So my thing is not as an independent or a libertarian or a Democrat or a Republican. I just think we have a democracy that we've about to celebrate its 250th anniversary on, and we should really make health as a basic human right for one and all. Because if we have immigrants coming into this country and doing all the farm work or the construction work, they have to be looked after if they need health care, and housing and transportation. So I think this is a great country with great spirit, but we just have to dig down a little deeper to see a movement forward that is collective, and we get to a better place where everyone feels that this is their society, not our society or your society.
Well, let's talk about, and I'm sort of getting back to what maybe my previous question. Okay, you talk of the example of the rural communities and what that specific issue was in Appalachia. I never pronounced that correctly. Um, what about cities? What do you
Cities,
see?
in some ways, there's a hybrid between the cities and rural America. So if you go into East Oakland, it's got its significant issues too. They got poor health, they got drug addiction, they got very poor education facilities, a high unemployment rate. So they have the issues. So the poor, the compromised individuals in society is the same. You have problems with um, the family dynamic. I did a major project last year on extended learning in an academic community project. And with it, it turned out that academia did not have a clear understanding of youth education. The community was looking for a contract to hire minority people in the afternoon to mentor the children. The state didn't have a consistent message. They allocated funds, and now those funds are drying up. So the whole issue, if you've heard it recently, of education for our youth is in jeopardy. And then it goes even further up into the technical and the college level. And then the employment issue for the young people who are looking for jobs. The tech industry is compressing, the healthcare industry is compressing, especially biotech. So we have to find a way to shift the focus of our creative talents.
What about, and I asked, maybe I'm asking this question now in every interview, where does AI come into this picture? I mean, I find myself, you talk about experts, and I'll admit now, if I have a question, I go to Chat GPT
I
4.
think you're totally appropriate. The question is, are you overly dependent on it? Do
Yes.
you trust it totally? Do you need a human voice, especially in the health area, to interpret what the data is? So I'm a fan of AI. I mean, you can look at it also from the other way. The data centers are consuming vast amount of water, burning up a lot of oil chemical for their heating. So there's a downside, and we've had AI actually for 30 or 40 years to one degree or another. And now it's moved to a major issue. And it's part of our society. Before that, we had the internet, so or the cell phone. So it's a change, and that's a very positive sign, AI. However, it has to have some degree of standards and regulations, so there's an oversight on it.
Yeah, I actually tested it. I asked a question that I knew the answer to. It was a simple question, but I was, and the answer that they gave, that AI gave me, was incorrect.
Okay,
And then
that's a perfect
yeah,
example.
yeah. So yeah, you can't totally rely on AI, but we have to, yes, we have to integrate it into our system, I guess, our system of government. I just had a question because I have in my notes here that You are a consulting professor at Stanford School of Medicine. So what are the students, the Stanford students, the medical students, what's their take? What's their read on this? That's a generational change, I would say, from either you or I.
Yeah, I mean, I think they're enthused and committed to entering into the healthcare arena. They're challenged about work-life balance. They're challenged about which pillar they're going into. There's definitely pillars in being a physician. Are you a neurosurgeon, a cardiovascular surgeon? Are you a dermatologist? Or are you a geriatrician or a pediatrician? There's different economic incentives. There's different job incentives. Who are you working for? Are you an independent physician? So in rural America, almost all the physicians there were independent. Now they're owned by private equity firms, so they don't have as much voice. There's a workforce shortage that's significant. There's a transportation issue of how do you get from A to B if you need hospitalization. So I think most of the students now, and I'm not speaking for all of them, want to know what's the role of AI. How much are they being taught about basic issues on prevention and promotion, whether it's nutrition, sexuality, and the like, or how much are they talked about just technological and drugs? There is a great dependence on pharmacological agents in this society using data from your blood or from other vital specimens. So I would think it's a great time to be in it, but I think you have to have a good sense of self and where you want to go into it. And I would submit that you have to have mentors, both from your own age group as well as more senior people who have an experience base to it.
Well, I don't have another question because we have run out of time, but so give us a website and/or websites, other platforms to go to for more information about what we've been talking about and your work.
Well, I think you can go to healthierwe.org. That's the our website for our not-for-profit that deals with health. You can use people like yourself, Kathryn Zox, or there's a Kevin MD. You can use Medium has this. There's numerous sources for knowledge. The point is the individual has to trust and the information has to be transparent and honest. Johns Hopkins has a great website for health related this information, as does Mayo Clinic. So those are just some, and I'm not their sponsors, by the way.
No.
I'm just saying there's a voice, and I can't thank you enough for having me on. You someday I'll get to know who Kathryn Zox is, the
Right.
person.
Thanks so much for being on the show today. Obviously, it was great information and love to have you on the show again. And I've been talking to Dr. Phillip Polakoff, MD, and the topic has been threats to democracy are bad for your health. Thank you so much.
Thank you.